Hello everyone, in this video we will discuss electroencephalogram, EEG-based emotion recognition system and its applications. Let me start with some general information on emotion recognition system. Development of intelligent emotional assessment system is very advantageous in human-computer interaction, HCI, applications. HCI enables human to interact with computers, especially through human responses and behaviors. Communities like the workers in industries, students, as well as the patients in hospitals can make use of this application to predict their emotional states and also to maintain mental health from time to time. This is important to sustain the quality of human life in the society well-being. Over the last decade, people have interest to analyze the emotions through different modalities. Numerous methods of emotion recognition are considered in the previous literatures, such as based on gestures, facial, speech, and physiological signals. Physiological signals are generated by the body during the functioning of various physiological systems. These signals are acquired and processed to find out the state of the functioning of these physiological systems. The emotional states can be revealed by physiological signals through the changes of physiological responses. So why physiological signals are being used? Gesture, facial and speech are observational-based approaches. These approaches can be purposefully expressed and easily faked by others. Whereas the physiological signals are involuntary responses that cannot be controlled. Another reason is the observational-based approaches show the emotional states that they think they felt. However, the physiological signals reveal the inner feelings or the true feelings. Here are some examples of physiological signals that have been used for emotion recognition in past studies. The heart rate can be recorded as one of the physiological signals that reflect emotional responses, such as the heart rate being erratic and disordered during anger, frustration, and anxiety. Electrocardiogram, ECG, signals capture the heart activity that causes rhythmic changes in the heart. While photoplethysmography, PPG, is a signal to measure the blood volume changes during heart activity from the fingertip using an optical sensor. Next, the surface facial electromyogram, EMG, measures the electrical impulses during the contraction of facial muscles. Also, studies have shown that the frowning muscle expresses our primary emotional evaluation of things we encounter. The electrooculogram, EOG, signals show the eye's movements. Horizontal and vertical EOG signals can be used for emotion recognition based on gaze tracking and detection of eye movements. On the other hand, changes in emotion might cause pupil dilation. Pupil dilation is one of the involuntary responses. The pupil size is measured as its response to emotional states. For examples, pupil dilate during frightened or excited states, meanwhile pupil constrict during focused state. Next, the skin temperature changes during different emotional experiences, either rise or fall, can be used for emotion recognition. Furthermore, skin temperature can be implemented in stress assessment, where it is able to reveal the intensity of acute stress. On the other hand, the galvanic skin response, GSR, measures the skin moisture level, which is the sweating or the changes in sweat gland activity. It reflects the difference in the sympathetic nervous system. Research has shown that increase in sweating is linked to emotional arousal. Next, the emotional experiences of humans are controlled and regulated by brain networks that are formed by the interconnection between different brain regions. Meanwhile, the hypothalamus in the brain takes the role of controlling physiological activities. In order to identify the emotional states, the brain signal is the most reliable physiological signal that could reflect the brain's activity of emotional experiences. The brain signals can be recorded using different techniques, such as magnetoencephalogram, MEG, and electroencephalogram, EEG. MEG detects the magnetic fields induced by intracellular currents, whereas scalp EEG measures the electrical fields generated by extracellular currents. Also, the MEG requires magnetometers and operates in a magnetically shielded room. Hence, the EEG signal that is easier to operate is one of the most frequently applied neuroscientific techniques. The readily available EEG devices on the market make them the most frequently used. In addition to this, there are a few more features that make EEG devices popular for research. So, first, the EEG devices are reliable. The EEG sensors covered the entire scalp, hence the EEG signals can be obtained from different brain regions. Moreover, the number of electrodes can be selected based on needs. It can be a single electrode or as many as 256 electrodes. The second point is cost-effective. The EEG devices can be bought at an affordable price. Next, it is safe to use. Most EEG devices are non-invasive. It requires the application of conductive gel or conductive liquid between the electrodes and the scalp during data collection. The process is safe and the subject can be in either conscious or unconscious states. Moreover, the EEG devices are easy to use. The EEG devices are layman-friendly, easy to operate and require less time for setting up. Therefore, the users can use the device without the presence of experts. In addition, the EEG devices are portable. Unlike other brain imaging techniques, such as positron emission tomography, PET scans, functional magnetic resonance imaging, fMRI, scans and the MEG signal, the EEG devices are less bulky and portable. This means that the EEG devices can be carried anywhere and have no restriction on data collection locations. This creates convenience for people with reduced mobility. Here is an example of a 14-channel wireless EEG device, Emotive Epic. Now we turn to the applications of the EEG-based emotion recognition system. This system is able to detect emotional abnormalities. Mental illness is invisible, but EEG signals can be used to detect people with depression, anxiety disorder, or schizophrenia. Next, it can be used for the emotional assessment of patients with facial paralysis, for example, stroke and Parkinson's disease. These patients are unable to speak clearly or show facial expressions. In addition, it can be a substitute for conventional approaches, such as questionnaires and interviews. The emotion assessment through questionnaire and interview requires the opinions and experiences of experts. However, EEG-based emotion recognition is done by machine learning or deep learning classification. Hence, the presence of a professional or expert is not required for this emotion recognition system. Furthermore, this system can be used for neurofeedback training. Based on such neurofeedback, the treatment or therapy can be adjusted to the patient's needs. On the other hand, an EEG-based emotion recognition system can be used for driver's drowsiness tests. The mental states when the driver felt calm, anxious, or depressed can be detected. In brief, the EEG-based emotion recognition system would be remarkably useful for a wide range of applications, especially in the area of psychology and sociopsychology. This system could enable endless opening possibilities of EEG-based application implementations for marketing, entertainment, and medical applications.